Hi everyone, Dr. Nemechek here. I want to talk to everybody a little bit about, because I'm sure you've gotten this kind of look from other people when you say, oh, Nemechek's thing can fix this, and it can fix that, it can fix this, and they look at you like you're half crazy. It's like saying this one medicine in the pharmacy can fix cancer and heart disease and strokes and depression and all these things. And they're used to things not working that way. And that's because our approach in medicine, and this is just by our lack of understanding for a long, long time, was really about trying to control symptoms to make people stay better. Control the depression, control your reflux, your pain from your narrowed heart arteries, or preventing another stroke. And so it was all about trying to just kind of limit your problems from something you already have. Well, we now understand that the vast majority of all these conditions are being driven by inflammation. All right. You're either going to die of a severe genetic disorder, and that's usually will kill people early in life, like a car wreck, something in the environment, car wreck, gunshot, something like that, an infection. Okay, and infections are about 15% of cancers, believe it or not, are triggered by infections. And then pretty much everything else is triggered by inflammation. And so we know inflammation's really this top level driver of disease. And then the other thing that we've discovered is your body has a tremendous capacity to recover from a disease state, that you can reverse things, actually. And to a great degree, it's predicated on just controlling inflammation. If you can get inflammation down enough, nerves, especially the central nervous system, your brain can recover, peripheral nerve damage can get better, hypertension, your high blood pressure can go away. There's some dietary studies where they use these extreme kind of vegetarian diets, and they can reverse atherosclerosis, the narrowed arteries of the heart. So your body can recover, okay? And it's just being driven by inflammation. And that's all I focus on. It's just inflammation. And I have early training in this in my HIV research days. Most people don't speak of it as this, but really HIV kills you with inflammation. All right. Now people say, no, it's the immune deficiency that kills you. Well, that's caused by inflammation, triggered by the virus, actually. And so it's all about inflammation. And we have this second book that's come out, and it talks about ADD and POTS and this condition called PANS or PANDAS, and then emotional dysregulation, so bipolar, chronic depression, schizophrenia, generalized anxiety. All of them are being shown to be associated with high levels of inflammation. And instead of the typical medical fashion of going through and trying to find some little thing where we can give you one pill for it, work on reducing the total inflammatory stress. Now, we're still a couple years away, I think, from having some very accurate and useful tests to help us determine what true level of inflammation do we have. And we have a variety of different tests right now. We just don't know what they mean exactly for an individual. And then, as I talk about quite frequently about the leaky gut, or the medical term for that is intestinal permeability, being able to measure that. So we're still a year or two, maybe 3 away from being able to actually give you a therapy, and then say in a month's time, we're going to recheck your inflammatory markers, recheck your intestinal permeability markers, and see how effective it was. And then we'll be able to more rationally kind of stack things to drive that down. But in the time being, you can get a long way by fish oil, the olive oil, using inulin or rifaximin to control your gut bacteria. Post-COVID, trying glutamine if you've had trouble since COVID. And the COVID would go on top of using rifaximin. And then the addition of a vagus nerve stimulator at the ear The vagus nerve is one of your master regulators of all the inflammation in the body. So we're just trying to go about at this time point trying to dampen inflammation while we're waiting for this testing to be available on a more accurate level that we can use. So I hope that's helpful to you all. Everybody have a good 2024.